Welcome, everybody. As you are joining, if you could put your name and organization in the chat, that would be wonderful. And we are going to get started. I want to start off by thanking you all for joining us today. I'm Carly Osceola, the Senior Vice President of Community Impact at United Way of Mass Bay. The team at our United Way and United Ways across the country have worked throughout the last couple of years to support our community partners and the work they've done to support individuals, families, and children throughout the COVID-19 pandemic. In Massachusetts, our United Way has worked with 15 communities to launch COVID relief funds, and we deployed over $25 million to nonprofits to directly meet specific time-sensitive needs of the folks with those they work with. We've also maintained close relationships with our partners to hear what they feel the greatest needs and concerns are. Today, we're here to talk about developmental screening, a key strategy that supports young children and that we've championed since 2014 through our DRIVE initiative. We hope that you will hear today the value in working for universal developmental screening so that every child has access to be screened, every caregiver has the chance to be engaged as their children's first teacher and early learning advocate. Every provider and program has the resources needed to support children in screening and connecting them to the needed resources so that every community can check in collectively on how young children are doing in the pandemic and post-pandemic. We're going to start off shortly with an overview of a DRIVE issue brief that we're releasing today that focuses on the question of why developmental screening and why now. We'll then spend some time with a panel of early childhood experts to provide their perspectives on this overall question as well. With that, I'm going to turn it over to Carla Terrio, who leads our early childhood work at United Way and is a tireless advocate for developmental screening, to give an overview of the issue brief. Over to you, Carla.
Thanks, Carly. And again, thank you all for joining us today. We're excited to share this information with you and for you to hear from our panelists. As Carly mentioned, the motivation for this brief at this time is to uplift the potential needs of young children following 2 years of disruptions caused by the pandemic. I'll start with the why of DRIVE before we get into more of the why now. At DRIVE, we champion 2 parent-led developmental screening tools, the Ages and Stages Questionnaire and the Ages and Stages Questionnaire Social Emotional, providing wraparound supports for community partners to be confident and effective in engaging families with these screening tools and in collecting data to support aggregate analysis at the program and community level. We work with community-based providers as well as trained DRIVE parent screeners who meet families where they are in community to provide access to screening. DRIVE started out as part of a partnership with the City of Boston called Thrive in 5. And as Carly said, came to live at United Way in 2014, where we recognized that the Screen to Succeed component needed to continue in order to meet a community need, which was looking to fill the gap where there was little aggregate data from when children left the hospital to when they started kindergarten. We know that this age range, birth to 5, is significant. 90% of brain development occurs between birth and age 5, and the earlier that needs can be identified, the better. Pre-pandemic, experts estimated that 1 in 6 children had a learning delay or social emotional concern, yet only 20 to 30% of those needs were identified before entering school. Reliable and validated screening tools like the ASQ and ASQSE increase that identification to 70 to 80%, giving children an earlier chance to connect to any resources that they may need. To all of the early childhood folks on here that are listening, I know this is old news for you, but for folks who may be earlier on in their learning about this field, I hope you'll walk away today keeping these statistics with you. We have learned an incredible amount through the years of DRIVE, but 3 significant points resonate currently. DRIVE works because we have more than 75 community partners who are fantastic and committed to, among all else they do for families, making developmental screening a priority. A major learning for us through the pandemic was that our partners who were trained, prepared, and committed to screening kept screening during a time when safety was the above and beyond #1 priority. More than 3,000 families have been screened by DRIVE partners since March of 2020, each signaling a child and caregiver connected to a program and community resource during a time of isolation. You'll likely hear from Lillian and Hong on the panel later about how Leo and Lynn continued screening throughout the pandemic and how parent screeners in Boston continue to support families in the community with screening. Drive also has room to grow. Screenings should lead to referrals to needed resources, including to special education and early intervention services, the IDEA Parts B and C respectively, that are designed to address developmental delays in young children. We see the reported number of children whose ASQ scores indicate a potential benefit from a referral to be lower than anticipated. So we have work to do here in terms of tracking this data, as well as understanding more fully what obstacles may exist to making referrals. We hope to learn from emerging cross-sector partnerships about how this connection can be supported. And lastly, our data shows that when children are screened multiple times by Drive partners over a year or more, their scores improve. This data can't explain the why of those scores improving, but these patterns are useful in aggregate to see the value of screening systems' potential for monitoring ongoing child development. This highlights two separate but related points. Continued connection to a Drive partner encourages rescreening, and rescreening allows for ongoing monitoring of children's development and touch points with parents. Through our partnership with Massachusetts Early Education and Care over the last few years, we've built and used an ASQ data dashboard that aids programs and communities to do this type of analysis of aggregate ASQ data for themselves and to look further at other patterns specific to the families and children that they support. So that's our why. Through Drive, we've seen the value of developmental screening for children, families, programs, and communities. So why now? It's been top of mind for us throughout the pandemic that young children have been missing opportunities to be seen and screened, and that following 2 years of interrupted childcare, disrupted routines, social isolation, loss, limited access to in-person supports, and undoubtedly increased stress on parents and caregivers, there's bound to be an impact on young children. Think back to those statistics I mentioned. 90% of brain development occurs between the ages of 0 to 5. 1 in 6 children is estimated to have a developmental delay or social emotional concern. And this second statistic is pre-pandemic. Early research out of Brown University and New York City indicates developmental impacts on babies under 6 months of age who were born during the pandemic, specifically lower ASQ scores in fine motor, personal, social, and cognitive skills. Anecdotally, from early educators, we're also hearing that children are coming into classrooms with significantly higher levels of need, and specifically with social emotional concerns. One consequence of the pandemic was less easy access to screening. Data analysis completed by the Boston Opportunity Agenda last year found a decrease in early intervention referrals and services for birth to 3-year-olds at the beginning of the pandemic, as well as a substantial decrease in childcare availability, resulting in fewer children in former childcare slots. Additionally, pediatricians nationally reported that 16% of low-income parents had postponed well visits during the pandemic. Cumulatively, these are all missed opportunities for conversations about child development, access to developmental screening, and subsequent resources and referrals. So before we go into our panel discussion, we want to share our recommendations for actions that can be taken to build towards universal access to developmental screening. We see the need to build a network of screening champions, and we see that starting today with all of you. There's a need to increase the awareness of developmental screening and destigmatize and demystify screening so that all families feel it is accessible. We see the need to research the effectiveness of screening results in receipt of needed services. As I mentioned, we've seen that not as many children as we would anticipate needing a referral based on an ASQ screen are being reported as connected to a referral. There are 3 key parts to this recommendation: collecting more data, collaborating and sharing data to create the fullest picture of children's need, and ensuring that all children who need a referral are being connected with one following a screen. We also see the need to foster cross-sector partnerships. There is lots of great cross-sector work that's happening that has the potential to work towards alignment of best practices, collective recommendations, and increased data sharing opportunities. We see the need to employ technology to increase awareness and access for families. What if a caregiver or a caregiver's caseworker or friend could go onto a website and search by zip code for what organizations offer developmental screening nearby? We urge this to be a time where we are innovative and look to cross-sector partnerships and communities to highlight successes and see potential for replication of best practices. And lastly, we see the need to invest in screening more children. The messengers of developmental screening are vital to its success. Drive parent screeners like Hung, who you will hear from shortly on the panel, meet families in the community where they're at to support them in getting screened and getting connected. Yet these programs are often working with limited budgets that do not allow them to grow to meet the community need. Investment in programs that champion developmental screening would increase sustainability and further progress towards universally accessible screening. You'll have a chance to see all of what I've shared today in our Drive issue brief that we will email out following this event. Our contact information will be at the end of today and in the email should you have questions or want to talk to us more about this work. Please also feel free to put questions in the chat. We may get to them during the panel discussion, and if not, Jen and I will follow up after today's event. So with that, I will turn this over to Jennifer Takado, our Drive Program Director, to introduce our panelists and moderate our panel discussion.
Great. Hi, everyone. Thank you, Carla, for that overview, and thank you all for joining us today. I get the pleasure of introducing and talking with our panelists today. I would like to get us started by letting you all know who our panelists are joining us for this important conversation. With us today, Hung Vu is a Drive Fellow at United Way. Hung has many years of experience working directly with children and families in her role as a family engagement specialist for Boys and Girls Club of Dorchester, as well as a parent screener and coach. Hung is trained in administering ages and stages questionnaire and best practices in developmental screenings. Hung's efforts in this work have allowed hundreds of Boston families to receive developmental screenings and resources needed since 2015. Next is Lillian Romero. She's the Chief Program Officer at LEO Inc. in Lynn. Prior to working at LEO, Lillian was the Regional Director at the Massachusetts Department of Transitional Assistance. She oversaw the day-to-day operations of a group of local transitional assistance offices in South Boston and Northern regions, which administered the Supplemental Nutrition Assistance Program and Temporary Assistance for Needy Families Program. Next with us is Sarita Rogers. She's the Deputy Director of Programs at the Children's Trust of Massachusetts, where she has oversight of all Children's Trust family support and professional development programs, including Healthy Families of Mass Home Visiting, Safe Child Prevention Initiative, Family Centers, and the View from All Sides Annual Conference. The Children's Trust is a state agency that has the sole mission of preventing child abuse and neglect in all its forms. Next with us is Aisha Kammertz. She serves as the Senior Manager of Community Programs and Early Childhood Lead at Boston Children's Hospital, Office of Community Health. She leads the Birth to 5 Child Health and Development Initiative, a 10-year, $17 million grant program to support early childhood education providers across Greater Boston, build and grow foundational care. Aisha worked at Mass Health as a senior policy analyst and the chief of staff supporting the implementation of the state health care reform. Also with us is Dr. Dan Hall. He is a primary care pediatrician at the MGH Healthcare Center in Revere. He completed med school at BU and pediatrics residency training at MGH and has worked at Revere ever since. He is also an associate program director for the residency training program in pediatrics at MGH, responsible for primary care clinics and teaching curriculum. Welcome, everyone. All right. Great, so we are going to get started. This first question is going to be for our first panelist, Hung. So Hung, in a few sentences, how would you describe the benefits of developmental screenings? Feel free to use real life examples of how families benefited from a screening with a parent screener in your experience as a family engagement specialist at Boys and Girls Club of Dorchester.
Good morning, and thank you for having me today. I would like to start my answer with a little bit background of the work of the parent screener. 8 years ago, Boston Prime 5 School Readiness Pilot, which is the former programs of the Tribe Initiative, have just started in Boston. And this program had an amazing effort to create a citywide screening system to measure the development of children in the early years. This program hired and trained a lot of parents to become the screener so that they can support other parents in screening their children's healthy development by using the ages and stages questionnaire in the neighborhood-based settings. And based on the result of the screening, we can connect family with resources and information for families. Even the Prime 5 no longer exists, but the model of parent screener has still continued at many family center organizations to make a great impact in Boston community. I can tell you the beautiful and unique points of the parent screener is they represent the multiple cultures and languages, and they can create the connections for hard to reach and isolated families. And they ensure all children are screened, especially children who are not enrolled in a formal childcare setting. And I'm so proud to be one of the original parent screener of Triumph 5 of a Pride initiative. Even now, I have stepped back to become a parent screener coach and trainer. As many of you know, not all of the children in Boston can afford childcare for their young children. And many of young children are cared by their family member or babysitters that do not have a great knowledge and experience in early learning. And I can tell you, like many immigrant families who are not familiar with early education system of the country, the challenge is even bigger. And for the family who have children with developmental delay, the fact that they cannot get the treatment at early age will make a big gap for them when they enter the school. At our program, we have tried to make the screening process at the center point of the family engagement and the child's well-being support. There is a circle of support around the families while the screening is the central point of that. At our Boston Family Engagement Network, we start the connections with a parent when the mom is pregnant. The mom, they will receive a welcome baby home visit after being home from the hospital by a certified home visitor. And then the mom will refer to our family engagement network so that they can participate in the baby cafe breastfeeding support group or parent-child play group. And the ages and stage questionnaire will be introduced to the family after a few months that will build a really strong connection and relationship with that family. There is always a happy ending after the screening. If the child is on track, we celebrate with parents about all of the milestones. But if the child needs more support or help, will be a bridge to bring the family to all of the community resources and referrals like early interventions, the special need program of Boston Public School, or further assessment. And the rescreening will be provided in the next 2 months if it is necessary. And thanks to developmental screening, we are able to bring a great team of community program staffs to support each of the families, such as like family nurturing program, Countdown to Kindergarten, Family First, or Boston Family Engagement Network. The work of us at a family screener never ends at just 1 or 2 meetings. We only complete our missions when we think the child is like will be ready and like do a great job at school. I wish that I can show everybody today a pictures of a 7-year-old boy who used to be diagnosed as an autistic child, but that family, they start to get enrolled in our program late when the child was about 2 years old. So we have done the screening for that family. We make the referral to early interventions, and we keep follow up with the family until the child was entered into Boston Public School special need program. And now we can see that family still be involved in our program by showing up at a playgroup, and then the child, they step up to help me to lead and read a book to young children. So that is a great example of the amazing job of the parent screener, how we can screen and support the family in Boston.
That's great. Thank you, Hung. And thank you so much for all the work you do with these children and families. My next question is for Lillian. For providers working directly with young children at Leo, what are you seeing developmentally for children as we emerge from the pandemic?
Thank you, Jen, and thank you for having me here today. Just to give you a little perspective of what we do at Leo. So we have a Head Start program that's for children 6 weeks to 3, and then of course our regular Head Start from 3 to 5. But we also, as HON organization, also we start with pregnant moms. That's how we start most of them. And as the same as Hong, we have a lot of support for moms while they're when they're pregnant. And then as they get home, we do the same thing. There is a person who is assigned to each family. That's the family service worker. That's the one person that will follow that family throughout the years for the most part when they're with us at Leo, whether it's on our early Head Start, our home visiting program, or our regular Head Start center. So one of the things that we do is the same thing. We do the ASQs, but one of the things that it's a little unique about Head Start is our whole family approach. So the whole entire family service at the same time. As you all know, children are affected by everything that happens around the home. Whether it's the stresses, with COVID-19, we're seeing a lot of that. And that's one of the things that we're starting to see a lot. So we do the ASQs, as soon as they get home to make sure that, that everybody's doing okay. We follow them throughout. And we, of course, use the Drive database to submit all that information in there as well. So that way, that's the reason why we're participating in this program, which is an amazing program, by the way. So one of the things that we're starting to see a lot is children with a lot more of the social, emotional, they're behind in that area. Part of it is because for the past 2 years, our centers have been open. So they're the little ones, the kiddo ones are at our centers, but then the older children were home. So, at home all day long in classroom, parents will be stressed out. So even though they were at the center, they would come home and find, the stresses of being home all day long, especially if they have older siblings, the isolation that they had for almost a year and a half, where they were not able to come to school for the older brothers and sisters, that affected the little ones. There is one specific example that I wanted to share is a little boy who came in and started early on, but at 3 years old, a year ago, came back, and it was like a whole different person. He was withdrawn. He didn't want to play with others. And he had a really hard time when we first started wearing the mask. That was really frustrating for him because he couldn't see his teacher's emotions because they also had a mask. So that was a struggle for that child. But one of the things that I think it's a unique thing on Head Start is that he needed a lot of support. The parents needed a lot of support. The siblings needed support as well. And they were able to receive those services, not only our Head Start Center, but also for the parents, because parents needed to know how to deal with him when he was acting out. So that was one of the severe cases where we had, and he's not the only one. We're starting to see that there's more and more of the effects of being isolated or coming to school and then home and then basically just being home all day long after that. And we're seeing that a lot more in the 3-year-olds, the 3 to 5 age gap. We see a lot of that. We of course see some as well on the early development, but on the 3 to 5-year-old, it seems to be a little more severe. And those are the things that, we work with early intervention very closely in Lynn. We are partners in many different ways. We reach out to them. They come into our centers to provide the services, because part of what we do at Leo Head Start is that instead of the parents having to take time away from work if they're working, because some of them are already working, we are the ones who coordinate all those services, and the services are received for those families, for the child at the center, as well as if the parents need some support, that also happens at our center. But if that doesn't happen, we also have family service workers who spend time with the parents at home, making sure that they have all the resources that they need in case they're having difficulties, as it is the case in our community. There's a language barrier for most of our clients. That's one of the key things for us. When we're hiring, that's one of the first thing our amazing team on our Head Start Center make sure that the teachers are also reflective of the community, reflective of the children that we served, to make sure that the parents have the support that they need. But we are seeing a lot more the delays in the social and emotional part of it, of the ASQs. Parents needed more support as well. And those are the things that we anticipate that we will continue to see for a while. But I think it's, organizations like Leo, but as well as, the organization that Hung works at, those are the key things. And those parent screenings that we do, making sure that we're ahead of those issues, so that way, as the children are developing, we can still assist them and help them and giving them the support that they need, so that way they can continue to thrive and be ready for kindergarten, which is one of the things that all of us, I think, have in common. We want to make sure that this group of 0 to 5 prepare in all the different areas to enter kindergarten. But we do definitely have a lot of work ahead of us as we come out of the pandemic.
Thank you. Thank you, Lillian. And thank you so much for offering your perspective and experience with children, these young children in this age group, that 3 to 5, and what you're seeing in centers and school settings. I think that's a really important thing for us to recognize and highlight in this work. So thank you. My next question is for Dr. Hall. As a pediatrician, can you talk about the value of developmental screening from your perspective?
Yeah, sure. Good morning. I appreciate the opportunity to speak to everybody. I think, developmental screening, sort of screening and referral in general, is our bread and butter in pediatrics, right? That's sort of one of the main things we do at our periodic well visits. And I think in particular, a lot of the screening tools that we use, they really help us to be more efficient, right? So there's not a lot of time we have with any individual patient during the day, and there's a lot of things we have to discuss. And I think having really good screening tools allows you to quickly get a snapshot of how things are going for that child. And then I can prioritize from there kind of what we're going to talk about that day. Another thing that I think is really helpful is often screening tools can help families to know, what their child is supposed to be doing at a particular age, right? And sometimes there's things on there that families may not even have on their radar, right? So does your child play peekaboo, right? Like a family might say, like, no, they don't, like, we don't do that. Like, and then that leads to a whole discussion about, like, why is that important? And what's the significance of these, like, reciprocal interactions at that age, right? So it allows us to kind of think with a family about stuff that they might not even be kind of on their radar. I think another really important benefit of, in particular, validated screening tools is that they really help to avoid bias, right? So they really help us to, one, bias in just like what I see in 20 minutes with a family is not necessarily what's going on in the whole rest of their life, right? If anybody's ever brought a toddler to the pediatrician, there's like a 50-50 chance they're going to scream through the entire visit. And so that may not be an accurate reflection of like that child's development. And so I can use a screening tool to really get a better picture of what's going on at home. The striking screener is like the MCHAT, right? And there's often sort of how a child appears to me right in front of me in clinic, and then concerns that come up on something like the MCHAT, the autism screener, that allow us to talk a little bit more and catch kids earlier than we otherwise would have, especially for things like autism. I think there's also a real value in having validated screeners that are translated across different languages, because with my own sort of cultural and language background, I may not ask questions, or I may not think about things the same way a family might if they have questions in their native language. And so it's helpful to have something that's translated and validated across different languages, so that we know people are that we're talking about the same thing. And then lastly, I think one thing that I find really helpful, a lot of our screening tools have questions that relate to routines and things like fussiness or dealing with transitions. And I think those questions often lead us to broader discussions about what's going on in a family's in their lives, right? And can help us to get at things like food insecurity and housing insecurity, and things that really you have to address before you can get sort of narrowed down to some of the more nitty gritty of language and social emotional development. So I think it allows us to really think about those things and sort of open the door for that discussion, right? Whereas a family might not come in saying they're particularly worried about something to do with their housing situation, right? But then you talk about how the child is having trouble with routines and how that reflects what's going on with, childcare and housing and that sort of instability. And it really helps to kind of put those things together. I think, frankly, a lot of the screeners also include questions about domestic violence and maternal depression. And I think those are questions that we just need to ask everybody. And so it's important to have that included in validated screeners that go out to everybody.
Thanks so much, Dr. Hall. I really appreciate that. And such a great point that really resonated with me is during this whole developmental screening process, I think, as you mentioned, it creates a space for providers and parents to be able to be in these conversations, for parents to be able to talk about the concerns that they have and maybe concerns that they didn't realize that they had. So I really appreciate that perspective. My next question is for Sarita. Children's Trust offers many programs supporting parents and children 0 to 3 years old. What major challenges have been faced by parents in the last 2+ years, and how has the pandemic impacted screening and/or referral services within your programs?
Sure. Thank you again for having me join the panel today. And I think we've already described some of the challenges that we know parents have had. They've been isolated. They have not had access to childcare, and sometimes they may not have had access to work. They have experienced all sorts of other just basic need shortages in their lives. So that has made a big challenge for families to feel like they could get all the needs of their families met. What we know through both home visiting and in our family center network is that parents at the start of the pandemic didn't really have many options for where they could go for services because so many services shut down right away. And we were really fortunate in that we were able to mobilize across both home visiting and family centers the ability to connect families to resources or just find a way to get them, right? If they needed diapers, if they needed food, if they needed, some sort of secure housing, we were able to provide that. But then because we were already tech enabled, and I appreciate Drive kind of highlighting the ability to use technology, we were able to continue service delivery as well. Now, that being said, it wasn't easy to do something like an ASQ screener via video with a child and a parent, but we were at least able to be in that place and be ready to move. And I think that's part of the one of the big takeaways. And again, I really appreciate the Drive's putting out this brief, is that we need to be able to leverage all the tools we have at hand in community-based programs to, fill gaps where we see them. And so eventually other services came back online and, we were able to make those connections. But we need to be able to work together to fill gaps when parents have them. So building that network, and then building the network, continuing to build a system where providers can talk to one another about what they're seeing, what they're learning, and how we can adapt what we're doing to meet families' needs, especially in a virtual service delivery world. What we are coming to understand now is that the virtual service delivery world will probably hold true for a lot of families. Families were able to feel comfortable and safe in a virtual format, particularly in home visiting and at some of the family center work. And while there are many that want to come back in person, there's still a lot of people who felt comfortable doing virtual work. But it also, the silver lining of COVID means that just like for school, there'll be no more cancellations for snow days for activities that might happen, because you can always just convert those to virtually. But the struggles that providers have had and that they've had to manage makes it really important that the providers have a good sense of peer support and being able to understand best practices. And I really appreciate Hong speaking to, trying to share with one another as providers, because that's really critical. You might feel very stuck with a family or stuck with how to do your practice, and you wouldn't be able to necessarily solve that on your own. But if you have some peer support, or even especially across programs, supporting each other so that we can all learn, that Head Start may have discovered a way to manage developmental screening that we haven't heard about yet in home visiting. We want to be able to share that. I agree completely with Dr. Hall about the not just screening, but also engaging with parents in conversations about how to support their child's growth and development that doesn't have to be as formal as EI, but could be just learning how to play peekaboo, learning how to make toys at home, singing, talking, playing with your child that people don't always think about, or it's not familiar to them, or they don't understand the value. That's a really important space that helps to bridge the time between rescreenings, even for parents and kids. It helps to grow their development, and being able to have strategies to do that together, I think providers can go a long way. We want to then also build that support network, because then when a family does maybe have a challenge, they can say, you know what, I'm going to refer you over to Jennifer at EI, and she's really great, and we talk all the time, and it's going to, it'll be fine. I can accompany you, but she really knows what she's doing. You'll feel really comfortable. Being able to provide an even warmer handoff than we might typically be able to do goes a long way in supporting families and helping them feel, I think it was Hong who mentioned, getting families familiar and comfortable with the process of developmental screening. That is really important, that they don't feel that it's a test necessarily, that they feel comfortable saying, we're really interested in your child's growth and development. Let's do this together so that we can understand how your child is doing. That goes a long way toward parents feeling invested in whatever the outcome is, and then whatever comes next. Because even if a child is developmentally on target, there's still activities and, reading books or other activities you want a parent to do to support their child's growth. So that is what we have put forward within our programs, and we are always on the lookout for other partners. And we have many other partners that are here on the panel to think about how we continue to build this platform for what Drive wants to do. Like, let's screen everybody. Let's do some universal screening across all of our programs. We have so many places where families kind of dip in and out, and working together, we can really build a cohesive network so that families don't slip through any of these gaps, and then work with healthcare and work with Head Start, so that we can all figure out the best ways to support families. Families are in all of these places at the same time sometimes. So we want to make sure that we are connected. And then when we get that opportunity to share the data and really look at who are we missing, what are we seeing, how can we work together, again, to support families and communities. The bottom line is, we want parents to feel confident, kids to have the skills they need and be thriving, from 0 to 5, at least when they get into school. So building our own networks and sharing data and sharing information back and forth is really critical.
Absolutely. Thank you so much, Sarita. I really appreciate how you highlighted the, making those connections to the many different sectors along this whole process with developmental screening, and just how, if we could all be kind of in communication and, kind of like a one, force for families, so that whole process really is an easy one for families, and they know, exactly where to go from a developmental screening to a referral. And so I think that's, one of the most important pieces of all of this is making those connections for parents and families. So I appreciate that. My next question is for Aisha. Could you please share why developmental screening and systems support are a priority in your work as a funder leading the Birth to 5 Child Health and Development Initiative at Boston Children's Hospital Office of Community Health?
Thank you, Jennifer, and thanks to all the panelists and to the audience. It's so great to be here with you all this morning. So at Boston Children's Hospital, our Office of Community Health manages our community benefits work, which is the space where we really work with our community partners and work on the social determinants of health, the things that families need support with outside of our clinical scope, really. And it's also about thinking about the families, whether or not they're patients of the hospital, right? So it's much more broadly thinking about the families that surround our main campus and all of our satellite campuses. And so we really are very focused with the Birth to 5 initiative and thinking about what are the effective levers of change to help families in the work that they're doing as families, right? Raising their children and working to thrive and get through their days, and how we can support them with the foundational skills that they need to continue to grow and develop themselves as families and for young children birth to 5. And really the importance of developmental screening and funding new systems that think about and center developmental screening is so that we can have supports in place to begin those foundational conversations, and that there's more of a network across our city that centrally is coordinated and working together to help families have these conversations, to reduce the stigma of even talking about early childhood development and having questions about your child's development. I know as a parent myself, that was a very scary question, especially when I was a new parent. I didn't want to imagine that I would have to even ask the question, right? But the truth is, those questions are being asked in pediatricians' offices and by early educators, and frankly, even in our social interactions. But there's not always a space where there's openness for that discussion to happen. So I think a key thing about developmental screening is, my hope is that it becomes something that is an opening for conversation that helps to norm the behavior around talking about early childhood development, so that people can all sort of come to a greater understanding that when we talk about early childhood development, it's not a question of whether the child is developing well. It's all children are developing in different ways at different paces, right? And we need to understand it better, right? So screening is to understand where children are, and to build those foundational opportunities for conversation, and obviously then for referrals to services, right, as they become needed. And I think, Dan said it very well, that it's really helpful and potent to do these screenings in a pediatric setting, but also, frankly, I think there's a lot of opportunity in the early childhood education setting and in other community settings, because it's that facilitating that discussion of thinking about what are the things that I'm not seeing right now in front of me with this child and with this family, and how can I understand a little bit better areas that I could support them if I have resources to offer and referrals to make. I also think there's so much power in helping parents really feel comfortable with this and having that trusted relationship with community, right? So we know that the pediatrician's office is one point of opportunity, but we also know, frankly, and I've lived this experience as a parent too, right? I go to my early childhood educator every day, and I talk to my mother 3 times a week. I'm talking to them a heck of a lot more about my kids than I talk to my pediatrician. I love my pediatrician, she's great, but that's not the sort of key interaction where I'm getting points of learning and understanding, and where I might be told, ooh, here's a referral, or here's a resource, or you might want to check out this play group, right? So finding those trusted relationships and building an understanding of tools like developmental screening tools, right, in those spaces where there's more of that foundational learning is a really important part, and what we see as a key lever to changing our environments, our communities, and our systems to better support families. So I also think, parent screeners being a very key part of that, and community-based organizations are a really key part of that. And that's part of the reason we see it as so fundamental in our funding strategy to support those community partners that are working with families. I feel like I could say a lot more but I'm grateful. I'm in a panel of people that have really said all that I would want to say. So I will continue on to the next step in our discussion.
Thank you, Aisha. I really appreciate that. And I love how you brought us the perspective as a parent yourself of young children. So I really appreciate that. My last question is for all panelists with us today. So I'm just gonna pose the question and then we'll kind of go in the same order that we did. So as we embark on pandemic recovery, in just a few sentences, what message do you hope all parents or caregivers receive around accessing developmental screenings and connecting to resources needed in their communities? So we'll start with Hung.
So during and after the pandemic at our organization, we use the screening as a routine tracking method to detect the developmental delays for the new children who just come to our program, or provide the information to parents who need to get their young children's developmental progress back to normal, back to on track. And the message that we hope to send to all the parents is, please do not ignore any signs of the early delays and bring your concern to someone such as like social worker, the pediatricians, teachers, or simply just a parent leader in the community. And we would love to partner with you as a parent who know your child the best, and we can make the most of screening and help ensure that your child meets their potential. We have worked really hard to create the non-judgmental environment at our program to provide ongoing services and support to parents. Yeah.
Thank you, Hung. And Lillian, I'm going to toss that same question over to you.
Thank you, Jen. And Hung, I'm so impressed because we do the same thing at Head Start. We literally hold people's hands. If they don't know how to reach out to another organization, we do that for them because, you know, we have that relationship that they trust us. They can come in and talk to us when there is an issue. And I think that's a key thing. You know, also as a community action agency, we know what other services are. We know who has what resources and who we can leverage. So being in a community and being part of that community means, you know, learning about creating that space for the parents to come in, a space where they can feel safe no matter what the issue is, whether it's the development delays for the children. And, you know, of course, you know, at the beginning, they get frightened about what do I need to do, but holding the hands, knowing that there is someone at our organization for our Head Start parents, for example, has been a key thing throughout the pandemic, making sure that, you know, that the services were there. But sometimes it's not just that, sometimes it's a lot of different things that affects that family. And I think that's one of the key things that at Leo, you know, one of the things that we always say is there is no wrong door. It doesn't matter whether we have the services or not. We know where to get those services for those families. We know how to link them to that. And, you know, as Sarita said, you know, getting to know people on those other organizations, and you can just don't give them a phone number. You give them a name, you know, and you follow up with an email. Those are the things that the families, I feel, coming out of this pandemic are going to need the most. Making sure that, you know, when they get to that place, they have a name that they're going to see. Because again, it's been, you know, some agencies closed completely, and trying to build that again for those families, to connect them to those resources are a key thing for success for the children, especially the 0 to 5, you know, that really need it. Those crucial 0 to 5 years are one of the things that I think all of us in this panel, I think are pretty proficient on how much we do as an organization, but we need to do even a little bit more to make sure that that trust continues no matter what happens.
Absolutely. Thank you, Lillian.
Thank you.
Dr. Hall.
So I think I would just echo the sentiment that to not wait, right? To you know, as soon as possible, sort of be thinking about this and talk to people with concerns, right? Like this, there's probably nobody that understands more the dividends that intervening early for kids pays on school readiness and kind of just getting set on a path for success. So, you know, I think the message in the pandemic, right, has been like, wait, and maybe not yet, and maybe next week. And I would say it's time to not wait any longer and just get it done.
Absolutely. Thank you. And Sarita?
Yes, picking up on what Dan just said, I think what we'd want parents to know is it's been a stressful few years. And we know that you want the best for your child. So there are programs and opportunities to partner with you to understand, where your child is now and help your child grow and learn and, connect, because we know you want what's best for your child.
Thank you. And Aisha.
I would echo a lot of what the panel has already said, but I think one of the things I would say is there's this balance, right? Saying to parents, you are the experts, right? You really are the ones who are spending the most time with your young child. And so trust yourself and let yourself ask questions. Part of being confident as a parent, right, and learning to parent is actually letting yourself ask the questions. It's okay to have questions. It's okay not to know things. You still are the one who has this deep connection with your child and knows so much about your child. So ask those questions, have conversations, have lots of conversations if you have questions about how your child is doing. If you're having trouble with how you're doing as a parent, if you can't quite figure out how to get to that play group, right? Ask the questions that, get you to the answer. It's okay to have questions. It's great to have questions, actually. It's what will build your village. It will help you connect to the resources you need. And absolutely do not wait, just because the pandemic has been such a hard time. Don't let the idea that anything you're seeing that's off, it's just because we've been in a pandemic. No, right? There's amazing things that we do and don't know about the pandemic. What we do know is that children develop so rapidly, right? Like Carla said, like the brief says, 90% of development before age 3. So any questions you have about our little ones, about your little ones, like come, talk, share, and make those conversations happen. Keep talking until you find the answer you're looking for.
Thank you so much. I want to thank all of you for joining us and sharing your perspectives on the importance of developmental screening. This has been a great conversation and one that I hope continues. I'm going to hand it back over to Carla for final thoughts.
All right, thank you so much, Jen, Hung, Lillian, Sarita, Aisha, and Dan. As Jen said, such an insightful and impactful panel discussion. I feel like the value of today's event is really in how Drive has given us this platform for your voices and perspectives as you speak for yourselves and the families you work with. So thank you all for taking the time to be with us today. We're putting these 5 recommended steps back up on the screen to kind of tie back into everything that we just heard. We believe that now is more important than ever to work for universal access to developmental screening as a strategy amongst many to mitigate potential long-lasting developmental delays as we emerge from the pandemic. We believe these proposed recommendations provide stepping stones to work towards universal screening with a strong emphasis on collaboration, partnership, and coordination, and that taking action will allow us to collectively work towards understanding how young children are doing post-pandemic and making sure that we know that they will be successful. And we believe that if we work together to build a growing network of committed developmental screening champions across stakeholders and throughout communities, we can have a lasting long-term impact on young children and their future development. So as we close out today, we are asking you to take these 3 steps with us. So the first is to fill out the survey that we're putting in the chat, to sign on with us as a developmental screening champion, and to share out the Drive issue brief with your networks when we send it out to you later today. Second, tell at least 5 people this week what you know about the value of developmental screening. And if you want to go into more about the why now and why it's so important post-pandemic, great. And third, go to the second link in the chat for EEC's Coordinated Family and Community Engagement Grantee Search Site. Put in your zip code to see the local CFCE that families in your community can call to get their child screened. This is, as you heard, one of many places where children can get screened, but this gives you a sense of where in your community is at least one place where families could start. We hope that you will take away today's messages in your conversations at your organizations, companies, and with your elected officials to advocate for including developmental screening as a strategy towards pandemic recovery for young children. Before we end today, we wanted to say thank you to those who have supported and partnered with us over the years. First, to United Way of Massachusetts Bay's private equity venture capital affinity group, who is largely responsible for launching Drive. We also want to thank the Massachusetts Department of Early Education and Care, who's been a great partner over these last several years. And thank you to the folks at DPH, the Children's Trust, and Executive Office of Education who spent time talking with us about all things ASQ. Thank you to the cities of Boston and Lynn, who've engaged with us around this work at a community level. And to funders like the Gisela B. Hogan Foundation, the Boston Opportunity Agenda, PNC Bank, and the Center for the Study of Social Policy for supporting the work that we do. And last but not least, a huge thank you to all of our Drive community partners who make a difference in the lives of children and families every day. Thanks again, take care, and we hope to talk more with you soon.